Hello everyone, welcome back to the channel. Today we're diving into an important topic which is low birth weight. So, what exactly is low birth weight? It's pretty straightforward. A newborn is considered to have low birth weight if they weigh 2.5 kilograms or less at birth, regardless of how long they've been in the womb. Low birth weight can happen for various reasons, and each baby's story is unique. Some babies are born small but healthy, while others face significant challenges right from the start. That's why it's essential to understand what causes low birth weight and how we can support these little ones. Now, why does this happen? Let's take a closer look at the predisposing factors. Several factors can lead to a baby being born with low birth weight. Let's break this down into maternal, environmental, and fetal causes. We're going to start with the maternal factors. The first maternal factor is maternal age. So mothers under 16 or over 35 are at higher risk. Imagine a young teenager or an older mom. Both face unique challenges that can affect the baby's growth. The second maternal factor is short maternal stature. Shorter moms may have smaller babies simply due to their body's physical constraints. The third maternal factor is socioeconomic status. Limited access to nutritious food and health care plays a huge role. For example, a mother who struggles to get enough nutritious meals might have difficulty providing the baby with resources they need to grow well. The fourth maternal factor is maternal diseases. So conditions like preeclampsia, hypertension, renal diseases, or any illness that reduces blood flow to the placenta can lead to low birth weight. For example, think about preeclampsia. It's like a traffic jam in the blood vessels leading to the placenta, making it hard for the baby to get the nutrients and oxygen they need. This can result in slower growth inside the womb. Other risk factors include multiple pregnancies. Twins, triplets, and more often share resources, leading to smaller babies. Ethnicity. Did you know that Asian moms tend to have smaller babies? Nutrition and genetics might both play a role here. Lifestyle choices. So, smoking, drug addiction, and poor nutrition during pregnancy also contribute. For instance, smoking increases carbon monoxide in the blood, which competes with oxygen for a ride to the baby, and oxygen usually loses that battle. Picture this. A pregnant mom who smokes is unintentionally depriving her baby of vital oxygen. The baby's growth slows down and they may be born smaller than expected. So, apart from those risk factors that we have discussed, we also have fetal causes. Under fetal causes, we have infections. So, intrauterine infections like cytomegalovirus can stunt growth. There's also congenital abnormalities. This can restrict a baby's growth, preventing them from reaching their full potential size in the womb. Now, let's talk about how you can spot a low birth weight baby. These little ones have visible muscle wasting, loose, dry skin, and often peeling or discolored skin. Their ribs are prominent and their abdomen is narrow. You might also notice their head looks proportionate to their body. But here's an interesting fact. Low birth weight babies are often more active and vigorous than preterm babies of the same weight. For example, if you've seen a preterm baby and a full term low birth weight baby side by side, you will notice The low birth weight baby is more alert and active. This is because they've had more time to develop their organs and systems, even though they are small. Let's discuss the problems affecting low birth weight newborns. So, low birth weight babies face several challenges. Let's go through them. We have asphyxia. So, because of low oxygen levels before birth, these babies might struggle during labor. Think of it like running out of air before you reach the finish line. This can lead to difficult coping with the additional stress of the birth process. There's also meconium aspiration. Stress from hypoxia can cause the baby to release meconium. That's their phase 2 into the amniotic fluid. If the baby gasps, they might inhale it, which can lead to respiratory issues. Imagine trying to breathe through a straw with mud in it. That's what it's like for these babies. It's a dangerous condition that requires immediate medical attention. Another problem is hypoglycemia. Low birth weight babies have fewer energy reserves. Their glycogen stores are low and they burn through their subcutaneous fat quickly. Symptoms include lethargy and poor feeding. If untreated, it can even cause brain damage. Infections is also another problem. So meconium stained skin can become a breeding ground for bacteria, making infections a big concern. Their immature immune systems make them especially vulnerable. Another problem is temperature control issues. With minimal fat and a large surface area, these babies struggle to stay warm. It's like trying to heat a big room with a tiny heater. Keeping them in a warm environment like an incubator can help. We also have polycythemia, so less common but significant. This is when the blood becomes too thick, slowing circulation and potentially causing complications. So how can we manage low birth weight? To start, let's talk about investigations. These help us identify the underlying causes of low birth weight and guide our management plan. Here's what we need to focus on. First, history taking. So ask the mother about her pregnancy history. For example, has she had children with congenital disorders before? Inquire about any maternal infections such as malaria, hypertension, preeclampsia, renal diseases, syphilis, or HIV. For example, if a mother mentioned she had malaria during pregnancy, this could help explain why the baby is underweight. It's crucial to connect the dots between the mother's health and the baby's condition. Secondly, we need to do laboratory examinations. So we need to do a rapid plasma reagent, which is RPR, to rule out congenital syphilis. So early detection can help prevent long-term complications. We can also do blood slide. If the baby has a fever, check for malaria. This is especially important in areas where malaria is prevalent. A full blood count can also be done to identify anemia, which can affect the baby's overall development. We can also do a random blood sugar to detect hypoglycemia, a common and potentially dangerous condition in low birth weight neonates. So each of these tests give us crucial information to tailor the baby's care. Remember, these are not just routine, they are life-saving tools. Okay, after investigations, we can now move on to medical therapy. Treatment depends on the results of the investigation. For example, if the baby has hypoglycemia, you can administer 10% dextrose to stabilize their blood sugar levels. Always monitor the baby's response to ensure they are improving. Prophylactic antibiotics might also be given to prevent infections, especially if there is a high risk of sepsis or if an infection is suspected. It's all about addressing the specific needs of the baby. Think of it like tailoring a suit. Each detail matters to ensure a perfect fit. Collaboration between healthcare team members is essential to get the best outcomes. Next up is the heart of neonatal care, nursing management. So the goals here are to improve the baby's nutrition, prevent infections, provide psychological support to the parents. So let's break this down further. So we're going to start with warming the neonate. So use an incubator or the kangaroo method where the mother holds the baby skin to skin. This prevents hypothermia and strengthens the bond between the mother and the baby. Kangaroo care also improves breastfeeding rates and promotes better weight gain. For example, imagine a baby snuggled close to the mother's chest. Not only is the baby kept warm, but it also feels safe and secure. This simple method has been shown to improve survival rates in low birth weight neonates. We can also create a clean environment. So you need to keep the area clean, quiet, well lit, and ventilated to promote rest, recovery, and good air circulation. A calm environment reduces stress for both the baby and the parents, supporting better recovery. You can also check the apical pulse, signs of tachycardia or bradycardia. Any abnormalities should be addressed immediately. Monitor respirations to ensure the airway is clear and unobstructed. Regularly observe for signs of respiratory distress. Also look for signs of anemia such as pallor and check the stool's color, frequency and consistency for abnormalities like blood or diarrhea. Diarrhea could indicate malabsorption or an infection. Okay, you also need to educate the parents on the baby's condition and explain the interventions like NG tube feeding. Use simple, reassuring language to ease their concerns. Teach mothers the importance of exclusive breastfeeding. Breast milk not only nourishes but also prevents hypoglycemia and malnutrition. If the baby cannot suck, guide the mother on how to express milk and use a cup or spoon for feeding. Demonstrating these techniques can empower mothers and build their confidence. When it comes to hygiene and feeding practices, make sure that you change the soiled nappies regularly to prevent infections and skin irritation. Even minor neglect in this area can lead to complications like diaper rash or secondary infections. So ensure feeding utensils are always clean and remind mothers to maintain breast hygiene. This simple practice helps prevent gastrointestinal infection. So these little details, they matter. You can also observe bowel movements. So you need to keep an eye on bowel movements to detect issues like intestinal obstruction or fecal impaction early. Prompt action can prevent severe complications. Finally, let's discuss some potential complications of low birth weight and why timely management is crucial. The first complication is hepatic jaundice. Due to the liver's inability to process bilirubin effectively, leading to yellowing of the skin and eyes, early intervention is key to preventing kernicterus. The second complication is compromised immunity. Because some organs, like the liver, are not fully developed, low birth weight babies are more vulnerable to infections. So proper hygiene and preventive care can make a huge difference. Hypoglycemic coma is also another complication. This can result from unmanaged hypoglycemia and is a medical emergency. Regular blood sugar monitoring is crucial. Brain damage is another complication. This is caused by severe malnutrition or hypoglycemia, which can have long-term impacts on the baby's development and quality of life. These complications highlight why proactive care is essential. Every step we've discussed today is designed to prevent or manage these risks. That's all for today's session. If you found this video helpful, please give it a thumbs up, share it with your friends, and subscribe for more health insights. And hey, if you have any questions or want to share your experiences, drop them in the comments below. Let's keep the conversation going. Until next time, take care and stay informed. Bye for now.